Hello, everybody. My name is Sukhman Sidhu, and I'm a dentist. Our topic for today on We Speak Science is swine flu. Swine flu, as you know, has had a recent outbreak in India, so I thought we should all be aware about the signs, symptoms, mode of transfer, and the treatment of swine flu. So, what is swine flu? Swine flu is a respiratory disease of pigs caused by type A influenza virus that regularly causes outbreaks of influenza in pigs. Swine flu virus can cause high levels of illness and low death rates in pigs. It may circulate among swine throughout the year, but most outbreaks occur during the late fall and winter months, similar to outbreaks in humans. Swine flu is a very contagious and viral respiratory disease. It is often fatal. Some other names for swine flu are swine influenza, pig influenza, hog flu, pig flu. Swine flu is a zoonotic disease. Zoonotic means it is an infectious disease which can travel naturally or transmit naturally from animals to humans. So basically, people who work with poultry and swine, especially those with intense exposure, are at an increased risk of infection with swine influenza. So now, how does swine flu spread? Spread of the influenza A virus is thought to be happening in the same way that seasonal flu spreads. Flu viruses are spread mainly from person to person through coughing or sneezing of people with influenza. Sometimes people may become infected by touching something with live flu viruses on it and then touching their mouth or nose. So, I know most of us eat pork and we have that question, can swine flu be transmitted through eating pork? So, here's the answer. Swine influenza viruses are not transmitted by food. You cannot get swine influenza from eating pork or pork products. Eating properly handled and cooked pork and pork products is safe. Cooking pork to an internal temperature of about 160 degrees Fahrenheit kills the swine flu virus as it does other bacteria and viruses. So now, how does the virus actually work? We know the virus is very contagious and it can cause pandemic flu, which could affect up to half of the population. So, the virus enters a body through mouth or nose, and then it moves into the airways and lungs. In the airways and in the lungs, it attacks cells that line the respiratory tract, replicating itself inside each cell until the cell dies, releasing more of the virus into the body. And then patient's immune system starts to hunt out and clear the virus from the body, leading to recovery. But if too many cells in the lungs are destroyed, the patient will die. So, who is at a higher risk for swine flu? Children younger than 5 years of age, people 65 years and older, pregnant women, or people of any age with certain medical conditions such as cancer, heart or lung disease, diabetes, and those with weakened immune system, which can be due to any reason. So, since it is swine flu, means it occurs in pigs also and in humans it occurs. So let's discuss first the signs and symptoms in pigs. It can be fever, lethargy, coughing, sneezing, difficulty in breathing, loss of appetite, abortion, weight loss, poor growth. So let's see. Physiological. It can be lethargy and lack of appetite. Respiratory, there can be coughing and sore throat. Intestinal, diarrhea. Nasopharynx, it can be sneezing or mucus, which can be released from nose or from the eye. And systemic can be fever, weight loss, or poor growth. Now, signs and symptoms in humans. It can be high fever, chills, headache, running nose, cough, sore throat, and sneezing, lethargy, body aches, fatigue, malaise, which is general feeling of ill health, muscle cramps, nausea and vomiting, and diarrhea. So let's see. Systemic is fever. The physiological sign and symptom is lethargy and lack of appetite. Nasopharynx can be runny nose and sore throat, respiratory coughing, intestinal diarrhea, and gastric nausea and vomiting. So now, since swine flu is so similar to common cold, let's see what are the differences between swine flu and common cold. So, fever. In common cold, fever is rare. In swine flu, fever is usually present with the flu in up to 80% of all flu cases. And the temperature can be about 100 degrees Fahrenheit or higher for 3 to 4 days. Coughing. So, a productive mucus producing cough is often present with a cold, whereas in swine flu, a non productive cough is present. Aches. There are slight body aches and pains in common cold, whereas there are severe aches and pains in the swine flu. Stuffy nose is commonly present with the common cold and typically resolves spontaneously within a week. Whereas in swine flu, stuffy nose is not commonly present. Chills are uncommon in common cold, and 60% of people with swine flu experience chills. Tiredness is fairly mild with the common cold, and tiredness is moderate to severe with the swine flu. Sneezing is commonly present with the common cold. Sneezing is not common with the swine flu. Sudden symptoms. So in common cold, symptoms tend to develop over a few days, whereas in swine flu, the symptoms develop rapidly within 3 to 6 hours. The flu hits hard and includes sudden symptoms like high fever, aches, and pains. Headache. A headache is fairly uncommon in common cold, whereas 80% of swine flu cases have been reported to have a headache. Sore throat. Sore throat is commonly present with the common cold. Sore throat is not commonly present with the swine flu. Chest discomfort. Chest discomfort is mild to moderate with the common cold, whereas in swine flu, chest discomfort is severe. So now, complications resulting from swine flu. There can be dehydration and electrolyte imbalance, obviously as a result of diarrhea. Then respiratory difficulty, which may require ventilation, pneumonia, worsening of any previous diseases like asthma, cardiac disease, diabetes, etc. Persistent high fever resulting in seizures, possibly coma. Sepsis, that is infection in blood, which can be due to pneumonia. Kidney failure. So now, how do we diagnose swine flu? History of the patient and medical examination can obviously help us to reach a presumptive diagnosis. Nasal or throat swab test can be used to identify the virus. Real-time polymerase chain reaction test. It is used to amplify and simultaneously detect or quantify a targeted DNA molecule. And another test can be antibody and antigen detection test. So, now I know this question might be in many of yours mind, that till when are people who have already been infected with swine flu contagious? So let's see. Okay, so about the first 2 days are the incubation. They are contagious even a couple of days before symptoms appear. Alright, so starting from the first day till the third day is the most contagious period. Symptoms may include fever, cough, sore throat, body aches, and chills. And the third and fourth day, fever breaks, but the patient is still capable of spreading the virus. Fifth, sixth, and seventh day, there is lingering cough, but the patient is still likely to be infectious. So, pandemic of swine flu. There was an outbreak in the US in 1976 from swine flu, another one in 1988. Then there was an outbreak of swine flu in 2007 in Philippines. In 2009, there was another outbreak in Northern Ireland, and 2015, there's an outbreak in India. So, what are the precautions that should be taken? The best precaution is to probably get a flu vaccine every year. Frequent and thorough washing of hands, use of alcohol based sanitizers, use of masks when going in public, disinfection of surfaces at home, avoid large gatherings and crowded places. Patients who are at a risk should remain at home, covering mouth and nose while sneezing or coughing, quarantine or isolation of infected patients. So, how can you protect yourself and others? Cover your nose and mouth with a disposable tissue when coughing or sneezing. Dispose of used tissues properly immediately after use. Regularly wash hands with soap and water. If you have flu-like symptoms, seek medical advice immediately. If you have flu-like symptoms, keep a distance of at least 1 meter from other people. If you have flu-like symptoms, stay home from work, school, or crowded places. Avoid hugging, kissing, and shaking hands when greeting. Avoid touching eyes, nose, or mouth with unwashed hands. So now, coming on to treatment of swine flu. Again, the best treatment for infection with influenza viruses in humans is vaccination. The vaccines are available in the form of flu shots, nasal sprays, or intradermal shots. 2 antiviral agents, namely zanamivir and oseltamivir, have been reported to help prevent or reduce the effects of swine flu. Then, supportive care at home or in a hospital focuses on controlling fevers, relieving pain, and maintaining fluid balance, as well as identifying and treating any secondary infections or other medical problems. On December 22, 2014, the FDA approved the first new anti-influenza drug for swine influenza and other influenza virus types in 15 years. That is peramivir injection. Peramivir injection is approved for use in the following settings. Adult patients for whom therapy with an intravenous medication is clinically appropriate based upon one or more of the following reasons. The patient is not responding to either oral or inhaled antiviral therapy. Drug delivery by a route other than IV is not expected to be dependable or is not feasible. The physician decides that IV therapy is appropriate due to other circumstances. Another can be in pediatric patients for whom an intravenous medication clinically appropriate because the patient is not responding to either oral or inhaled antiviral therapy. Drug delivery by a route other than IV is not expected to be dependable or is not feasible. That's all, guys. Any questions? Thank you and have a nice day.